issue briefing on the mental health work that's being done by the Metro IAF affiliates here in Illinois. We appreciate your attendance. We had a briefing last week regarding gun safety also. And what we'd like to do to start this session is we've got too big a group to do rounds, so we're going to break into one-to-one. You'll be paired off with one other individual, and we'd like you to relate to that individual on the one reason that brought you to this meeting. How were the quick sessions? It was a very quick one-on-one. Would anyone like to share what they heard in that, or what their reason for coming?
And one of the things we talked about was how it seemed like, at least on a statewide level, first quarter and maybe even going into the second quarter this year, we were making some real progress. And then now, unless something's changed, I feel like we kind of got stuck in the mud on the state level. And I'm hoping this meeting can get us energized and get us focused on getting us unstuck.
Thanks very much, Roger. I appreciate that. I think that was pretty spot on. And Adriana?
So I'm here. So I'm kind of dipping my toes in, DuPage United and everything that you all do. But the mental health is a huge, it's just really huge for my heart because it's very personal. And really, when I saw that it's about police reform as well, like education and we were just kind of talking about how there's just a hole in training of and the like. My mom was an addict. She passed away from her addiction, and and it's the police just had these. What am I trying to say? They had a view on her and couldn't get past she is an addict. And we came from a family. And so I can't imagine the people that don't have the means to go and get help. They are addicts and that they're getting turned away. That's just something that needs to stop. So that's why.
Right. Well, thank you. Thank you for sharing that. We really appreciate that. Anyone else? Carrie, why don't you go ahead? Thanks. Thank you, Yvonne.
Thanks, Yvonne. I met with Sean and we talked about how we were excited to hear what everyone was doing so that we collectively could kind of build on that power, not create the wheel, and move forward, building relationships within our communities and learning from each other.
Thanks, Carrie. I appreciate that. Yeah, and that is one of the goals, is to help build our power with this team. One of the reasons we're doing these issue updates. Well, thank you, everybody. And again, my name's Jim Schwerber. I'm from Ascension Catholic Church in Oak Park and a member of United Power. And I'm going to take a few minutes to frame the meeting. Illinois Metro IAF is reclaiming communities in several different ways. Number one, through our housing work in North Lawndale, Waukegan, Elgin, just to name a few examples. And I think also out in DuPage, there's work going on to convert a motel into affordable housing. So this is happening across the area. We're also doing it through our work to advance gun safety, to help prevent suicides, accidental shootings, and gun thefts. And finally, through our mental health work, including the new CSU at Ascension in Aurora, the living room in Evanston that we hope will be opening soon, and many other efforts throughout this region. Our approach on all three issues is fiercely nonpartisan, non-legislative, and winnable. It's based on the fundamentals of organizing, building relationships, organized people and organized money, power analysis, and doing the research. As I mentioned, last week we did an update on gun safety. Now that work began in response to the shootings at Sandy Hook. On the other hand, the mental health work didn't have one event that catalyzed people to action. This is personal. We're all touched in one way or another by mental illness, whether it's family, friends, or ourselves who are suffering. The question is, what do we do about it? And this is hard work. I'm involved because of Rich. He was a good friend of mine from church. When we were new to the parish many years ago, Rich talked to me and suggested some volunteer activities I could get involved in. He was a leader, and we worked closely together for years. What I didn't know was that he was bipolar. In many aspects, he was really lucky because he was a doctor and he was able to get treatment he needed and lived an exemplary life for many, many years. But unfortunately, eventually, he had to change his meds due to side effects, and the new ones didn't work as well. He was overcome by severe depression and terminated his life. When I saw what that did to his family and to him and our community, I decided I needed to be involved and do something to make a difference. Tonight, you'll hear about the work that is going on across all the affiliates, stories of some recent wins, and how we can take this campaign to the next level. We will then break into small groups to discuss our reactions to what we've heard, and then wrap up the evening with a call to action. So without further ado, I'd ask Marcia Bernstein is going to kick us off with some of the early work we've done on that was done on this issue in the area. Marcia?
Lake County United has been working on mental health issues for a very long time. It began in 2013 when we worked with the Lake County Health Department to create a questionnaire, a survey for people to share their concerns for healthcare. So our member institutions completed about 1,600 of these questionnaires. The data was analyzed, and the results were really very, very strong. Mental health care was just almost non-existent. People had no place to turn. There were a lot of tragic personal stories that emerged from those surveys, but that's really what got us going. And the research started, lots of research, and of course we came to find out that when there are no mental health care services and somebody's in crisis, all they can do is turn to 911. And now we're engaged with the criminal justice system. And where do they take somebody? First of all, law enforcement normally has more of a military response to a call, not, a caregiving guardian type response. And so it became pretty clear that something like CIT training was needed. And regionally, we had people go. We learned about this very effective diversion program in Miami-Dade County. So I was the lucky person to represent Lake County United, and we met with this remarkable program. Judge Leifman was the director, and as he said, when I was a judge, I could see this is what we needed. But it wasn't until he was the chief judge that he had the clout, he had the power to really get this going. And he pulled together funding streams, from the state level, from the county, from the city, from hospitals. And he's put together a very large staff, and they've been able to close a whole jail because of this. But the number one piece that was the bottom line is that those law enforcement officers that are going out to meet the incident, they need training. So that's where we came back and said, this is a big issue, CIT training. And then, of course, we had to convince our local powers that be of the need for this. So we did have a very successful assembly. We had about 400 of us show up. We had the county board president, we had the sheriff, we had head of the health department. We had a lot of important people. And I think they really came to hear, especially through the personal stories that were shared about the importance of this kind of training. And of course, now we all know, anybody who's been involved in trying to get CIT scaled up to the needs in Illinois, that was a big challenge. Illinois wasn't in place. But the upshot in Lake County is that we found a model that the state Illinois Learning and Training Board approved of, could be opened at the College of Lake County. And it has been very successful, and I'm very happy to say that almost 100% of all of our sheriff's deputies are now CIT trained. Plus a lot of municipal police officers too, but the sheriff department has really gone after this. So that's kind of how we started. Boy, we did a lot of research. We did a lot of meeting with all kinds of people, and figuring out where the power was and going for it. So I can go on and talk more if you'd like to hear about. After CIT work, we had no even a psych department at any of our hospitals. So we really helped to bring a behavioral health hospital to the county. We worked to support that process and to get approval at the state level. And now this is a hospital that is very fully booked. And we had hoped that we could have a crisis stabilization unit at the hospital, but that's still not possible. I think somebody will probably talk about all those the reimbursement challenges at the state level, and but we do have a living room model that we now have. It's been up and running since a year ago, August. And we met just last week with Advocate Condell Hospital because they know that something like a living room at least is needed, but we need to have sustained funding. So we're working, luckily the president of Condell is head of the Illinois Hospital Association, so we're looking to keep working at finding long-term funding for these kinds of services. So that's kind of the latest update of what we're up to in Lake County.
Thanks. Thank you very much, Marcia. And it really all circles back to the work you did, correct? The getting 400 people to meet with the county board, to doing the research and going to see Judge Leifman and see what he did down there. Absolutely. So that's yeah, those are the what everything has to build on, the work that our work has to start with. So thank you very, very much for your update on that. We appreciate it.
You bet.
Now, Yvonne Smith, would you like to go into
I saw in the chat a request to define CIT and a request to define living room. So if somebody could do that.
Okay, I'll do that.
Thank you,
Sure.
Yvonne.
Good evening, everyone. It's good to be here. My name is Yvonne Smith, and I am part of St. Nicholas Catholic Church in Evanston, and we are dues-paying members of United Power for Action and Justice. I want to build on some of what Marcia talked about. And as Jim has said, the root of our successes are based on building relationships with people, with police departments, with hospitals. Judge Leifman's model is based on crisis intervention team training. That's what CIT is all about. And that means that police officers go through a 40-hour training where they learn about all of the symptoms of people that are going through a mental health crisis. I spoke with a police officer in Evanston who said how important that training was, how it helped him understand what's going on with a person who's going through a mental health crisis. And it helped him to really relate to what was happening when he's called to that kind of situation in order to calm someone down. We know that an emergency room is not the place for people to take a person in crisis. Any of you who have ever been to an emergency room knows that it may take several hours before a person is seen. And if someone is in crisis, is agitated, and then there are little kids crying because they're in pain, that is not the place for them to go. So a crisis stabilization unit, which we abbreviate as CSU, is a place where a police officer can take an individual after the police officer recognizes that's the appropriate place, calm the person down. They will be evaluated by a mental health professional. Sometimes it's just meds that are needed. Sometimes they need a serious evaluation where they talk to a psychiatrist, psychologist, meds may be assigned. And then they may have to stay for 24 hours for evaluation. But it is a facility that's well-staffed, that police can bring someone to, that families can bring a person to a crisis stabilization unit to get the services that they need. So Evanston is in Cook County. We can talk a little bit about what we did in our community. We spoke to the Evanston Police Department, Skokie, as well as Rogers Park, to find out whether they were training their officers. It turned out they were, not in large numbers, but we stressed how important this was. We heard from police officers that if someone goes to an emergency room, sometimes within a couple hours, they're back on the street. So we tried to impress on them that that's not what's needed. Personal relationships again. So who do we go to? We went to hospitals. We went to Evanston Hospital. We went to St. Francis Hospital, which is part of the Presence system, which was part of the Presence system, to see if they were interested in setting up a crisis stabilization unit. That work is still ongoing. We didn't get a lot of successes in those areas, but we have had a success in terms of the idea of a living room. So what is a living room? We visited Turning Point Behavioral Health, which is in Skokie, which uses the living room model and has been using it for several years. Again, it's a place usually where families can bring a person in crisis and they get wraparound services. They may have a peer counselor that understands what they're going through, helps calm them down. It's a very comfortable situation. There are comfortable chairs. It's a quiet environment that takes an individual who's in crisis and gets them stabilized. The living room model has become very, very popular. It's probably less expensive to set that up. The living room, the Turning Point model is funded primarily through grant money from the state and from the county. In terms of what we're hoping for in our community in the Evanston, Skokie, and Rogers Park area, because of the relationships we built with the new mayor, Mayor Biss, and one of the alder persons in Evanston, that $900,000 of ARPA funds, those are federal funds, have been dedicated to opening up a living room in Evanston. It will be housed on St. Francis property. Hopefully it'll be open within a year or so. There are lots of stumbling blocks to getting it open, remodeling the building that's going to be used. And as we know, whenever there's construction involved, there are delays. But we feel that this is quite a victory to get the city of Evanston to agree to allocating these funds for this specific purpose. We know that mental health is just an issue that has come up, not just because of the pandemic, but because there just aren't enough facilities out there addressing the need that we have in our communities. So I just want to reiterate that the relationships that we were able to set up with the director of Turning Point, with our police departments, and with our hospitals has allowed us to move forward in this area to provide some additional services for people with mental illness.
Thanks. Thanks, Siobhan. Could you also talk a little bit about Holy Cross Hospital and the work
Sure.
that was done there
Sure,
with Governor Pritzker?
definitely. Holy Cross had a pilot program, a crisis stabilization unit, probably back in 2018. Because it was so successful, they were able to get funding to expand into a full-fledged crisis stabilization unit. At that point, the reimbursement rate by Medicaid was quite low. We talked to the Department of Family Services, dealt with the director there, but she wasn't willing to talk with us about what was going on. But again, by establishing relationships with one of the state representatives, we were able to get a meeting with Governor Pritzker. He said he would put us in touch with the director, and that reimbursement rate was increased to $900 a day. Because of that increase, Holy Cross opened in July of 2019. So what happened in 2020? The pandemic. Holy Cross needed that facility for COVID patients. So unfortunately it closed, primarily because of COVID patients. But there was also another issue. The police departments of the police, I guess districts that they're called in Chicago, that were in a reasonable distance to Holy Cross weren't taking people there. The hospitals in the area preferred the police to bring individuals to their emergency room. They felt they were losing funding because Holy Cross CSU was being used. So here was this brand new facility. We walked through there. I was there when Governor Pritzker came to cut the ribbon. It's not being used now, it's closed. Unfortunately, the state has now reduced the reimbursement rate for Medicaid down to $345 a day. So we've got a problem. We have to get buy-in from our police departments. So
Right.
unfortunately, that's one of the aspects of having a crisis stabilization unit that's really important. They need sufficient people coming through the door in order to keep it open. So we need the police departments to agree to do that.
Thanks, Siobhan. Yeah, and I think a great example of affiliates working together on that was, I think it was Anna Moeller, Representative Moeller from Fox River Valley, that was able to get us the meeting with Governor Pritzker,
Right.
to help us to get that rate raised. So that's an example of where we can combine our power and leverage our power. And there's a lot of work to do. I think that goes back to Roger's and Don's comments at the beginning from their one-to-one session. So thanks very much. And now we're going to hear about a recent win. Ann Alexander from Fox River Valley is going to tell us about Ascension Mercy Hospital in Aurora and the CSU that is going to be opening soon. Ann?
You heard about the various IAF community action groups working together, thoroughly researching the crisis stabilization units, including bringing Judge Leifman up from Florida. And everyone agreed this is a much needed alternative for police officers dealing with someone in the midst of a mental health crisis, rather than taking them to the emergency room or jail. We've already talked about the emergency room is not equipped to deal with these problems. And also the officer has to stay with his or her charge in the waiting room. And it's all the other medical emergencies that are taken care of before the mental health problem. And obviously, sometimes it takes hours and hours. And as mentioned, sometimes this person in distress is just released back in the community. And jail isn't the answer. Jails and prisons have become the largest provider of mental health services in the country. And prisoners with mental illness are in jail longer and are more likely to be abused. Both jail and ED are very expensive and have a low rate of return. So it was also a team effort to work with Governor Pritzker and the elected officials. I didn't realize that the rate has come back down again. My latest was from $80 raised to $800, and it was exciting to hear $900. However, cut that in half, but
that new rate is for a pilot program that HFS is says they're going to start. So
okay, so maybe the difference is the CSU that I'm going to talk about is
right.
in a hospital setting. Good.
Right.
And how did you get that going? What work was involved in that?
The groundwork was already done, all this research. When Michael Brown, head of Presence Mercy in Aurora, reached out to Fox River Valley Initiative in December of 2017 to explore the possibility of a CSU in his hospital. And Mercy was an excellent candidate since they'd always had a mental health focus. And there was an empty surgical space that could be converted to a CSU for maybe $1 million. It was a lot more complicated than that, but we had a vision. So 3 anonymous donors came forward with $450,000 to be set aside until the hospital could come up with matching funds, and that the project would get state approval within 3 years. So the clock was ticking. Despite inquiries, we didn't hear anything for several months. It turns out that Presence Mercy was now Amita Mercy, and Michael Brown had been replaced by Richard Rohr, the new president and CEO. We met with Rich Rohr and were really impressed. He's an Aurora native and cares deeply about the area and about mental health. And he explained the first plan had some serious drawbacks. So back to the drawing board for a totally new design on a much larger scale involving several divisions, including the emergency department. Dr. Berkowitz, a well-respected psychiatrist with CSU experience, was hired to oversee the construction and to be in charge when the facility opened. So we were back on track despite the COVID pandemic and sadly the death of the head architect. But the matching funds had been raised. So now the main challenge was approval by the Illinois Board of Human Services within that 3-year time frame. And the approval process included 16 levels of criteria, plus a final in-person presentation before the board in Springfield. Much to the hospital's pleasant surprise, the final interview was waived because the preliminary paperwork was so impressive and complete. Approval was granted and the promised funds were released. So a groundbreaking ceremony was held in the spring of 2021, and Fox River Valley Initiative was part of that celebration. The facility itself is a totally new wing with its own entrance, and in conjunction, the adjacent emergency department is being enlarged and upgraded. The CSU will be open 24 hours, 7 days a week. Patients can come in on their own or be brought in by family or friends. And of course, a police officer can bring someone in mental distress versus having to take them to ER or jail. There's a waiting area, a triage and intake room, 6 bays. I've got a, I don't know whether this will show. Yeah, pretty good. So there's the long nurses station right opposite these 6 bays. So the nurses station is directly opposite the bays, so nurses can closely monitor each case. There are 2 private rooms behind the nurses, which can be used either by the CSU or the emergency department. There are consultation rooms, showers, a living room with table and chairs. The whole place is designed with comfort and convenience and a calming atmosphere. There's sound mitigation everywhere. It's convenient that the hospital is able to admit anyone that needs more medical attention after 24 hours in the CSU. In the meantime, Amina Mercy is now Ascension Mercy Hospital. So it's never a dull moment. I'd love to know what the bill is for just changing their signage. I've been through the facility several times with many of you. Rich Rohr is very generous with his tours. He has every right to be proud of this accomplishment, and we are ready to go. But the grand opening has to wait until staffing is complete. And like all health facilities, we are really stressed with finding good staff. I have a feeling when word gets out at how beautiful this facility is, hopefully they'll be fighting to come to Aurora to work in this incredible space. But that's the challenge now. It's sort of like you're all dressed up and no place to go. It's ready and waiting when we've got the medical experts in the field of behavioral health. And
Right.
that's it.
Thanks very much, Ann. I appreciate that. I think we heard some interesting stories about the work that was done, how we accomplished what we've done so far, and some of the challenges we have to face still. But what we're going to do now is to break into some small groups. And I'd like
Jim,
Yes.
Jim, I think Andrea had her hand up. Did you, Andrea? Yeah.
Yeah, I was wondering about the facility in Aurora, if the police are more willing to bring people there instead of going to emergency rooms.
We've had several sheriffs. Ron Hain has seen it, and I think they're definitely on board. And many in Kane County have also had the critical incident training and can recognize when someone is in mental distress rather than just causing trouble.
Thank you.
Thank you. So let's break into small groups, and we'd like to get your reaction to this work and what you find interesting about it and what stuck with you. And then we'll break into groups for about 15 minutes and then have a quick report out and a call to action to end the evening. I'd like all the group leaders just to give a quick, like a 1 minute synopsis, and either the leader or someone in each one of the groups could do this, of what stood out to you, to the people in the group during the presentation so far. And I was going to ask Brian from our group if he would do it, to do a quick synopsis for us. Great, thank you.
I thought it was a really good discussion on the problems we have, and somebody in the group asked, how did it get this way? And I had a thought that it got this way like any other problem when you don't pay attention to it. When you say, nah, that doesn't need funding, or I'm just going to turn my back on it. And we have much more important issues than this. And I think that for me, my thought was, we just haven't paid attention to this. We haven't pushed hard to get the funding, get the resources that are needed. And just like any problem, when you don't pay attention to it, it becomes a real problem.
Thanks, Brian. I appreciate that. Jackie, would you like to tell us what your group thought?
Sure. We covered so much stuff, but it came up with, with the CIT, maybe people are being taken not as much to jail, but they're still to be taken to the emergency room because we don't have the CSUs and that kind of stuff. And Adriana asked, what's going on with the kids? We're mostly talking about adults, and that's an entirely different question. And I think that when we were talking with HFS, that there was some trial programs possibly going with the youth. I think that's where that other group that we were thinking about working with for the CSUs was probably working, but we're not sure.
Right.
We're talking about, generational, the people recognize mental health as a problem more than they did when some of us were younger. And kids are readily able to say, yes, I have this problem, or my family has this problem. But the people that don't agree with us, that we all know that we're trying to go in the right direction, but people that are thinking about, money, where, they want to keep people going into the hospital and that kind of stuff. How do we relate to them and learn from them, where the barrier is, so that we can change this over.
Okay.
Kim Swanson really has a question of, where are the living rooms open? They're not in hospitals. Where are they? Are they in community centers? I know the one in Elgin is at Ecker Center.
I think they're freestanding facilities in various locations. So
yeah,
we could get that information, get back to her with that. We could find that out for you. Why don't we go ahead and move on, Yvonne?
Our group talked about some of the same thing that Jackie has mentioned. One of the things that struck Kate, and just to get some detail, in Dade County, an entire section of the jail was closed after Judge Leifman was able to set up his program. So that tells us that we should be spending our money in a different way. So they were able to save money on the jail, but they were also able to provide services for people so that they became, important members of the community. We talked about the fact that we've been working on this for many years. Don said 10 years ago he was involved in this, and Sheila kind of chimed in. It isn't something that happens quickly. It's a long, slow process. We have kept working at it. We've kept talking with people that are interested and want to work with us on this. And that's how we feel this living room in Evanston will open. We didn't just all of a sudden get the money. We have been talking with St. Francis and Turning Point for years. So sticking with it, continuing to establish relationships, getting our community involved. Lots of folks see, at least in the city of Chicago, homeless people. Not all of them are mentally ill, but quite a few of them are. And with the pandemic, we saw definitely an increase in the homeless population, people on the street. So we're able to solve some of those problems by sticking with this mental health issue and providing services for a broader range of people. So that's what's part of our discussion.
Thanks, Yvonne. Marcia.
Yeah, well, I think we had a good discussion too. We had DuPage County represented, and DuPage County has gone its own route with a crisis recovery center, but it doesn't take people dealing with substance abuse or with people under 18. So, how do you keep moving forward? And the hope is that a new county board president will be elected and build that relationship to keep working toward a more comprehensive kind of CSU. And it was lovely to have Sean with us because he's from a congregation that is fairly new to United Power. Not like a lot of us that have been around forever. And he works in the mental health field and, you know, is just wondering how we might want to consider working with mental health community centers and other facilities that are already up and running, and that perhaps we can make some real improvements in mental health care by looking at those possibilities. So anyway, it's yeah.
Okay.
There's no doubt about it. The challenges are huge, and the mental health issues need to be addressed in a lot of different ways.
Okay. Thank you. Anne, did you lead a group also?
Yeah, our group, first of all, there were some questions about the Mercy CSU that I couldn't answer, like what is the area where, can someone drop in from Naperville? There are just some basic questions, and something that I forgot to mention is this facility is for 18 and older. Younger kids can come to Mercy where they would be handled on a regular, you know, come into the hospital rather than the CSU. And that's another thing to consider. But we were also talking about some areas there is definite opposition from, say, emergency rooms that have just, you know, rebuilt their facility for a bigger demand. Well, all of a sudden, if we're siphoning off the mental health issues, are they going to feel like we're stealing their business? And if we divert from jail, you know, are there going to be a lot of keepers that are out of work? Just things that you don't really consider. But my understanding with being involved with this all along, there has not been any serious opposition. The sheriff, police departments seem to really appreciate the fact that we have an alternative.
Okay. Thank you so much, Anne. I appreciate the report out. Ed, did you lead a group, or Carrie?
I did. No, I led a group. The initial reaction was, this is great work. It's so very important and so very necessary. And right after that, somebody brought up, it's almost shameful that it's taken this long to start moving the needle on these mental health facilities. We were struck too about how steady of a hand Richard Rohr has had in Aurora, never losing sight of the vision, never losing focus, always pushing to get this built. Another thing that was talked about is wondering if maybe some of these issues are not seen. How can we identify people early to get them these services, you know, before they get into mental health crisis? And can we expand into schools, maybe with our critical incident team training, and have teachers and social workers, school nurses all get that same training? And one thing that really struck me too was relationship building. Sue Lynn talked about relationships she has with doctors who are looking at different approaches to treating mental health. And, that certainly is encouraging. And, one of the people that was on our last tour of the CSU is running for DuPage County Chair, Deb Conroy. So a little bit of a relationship being built there as well. So it always goes back to that basic, principle of organizing, building those relationships.
Thanks, Ed. Appreciate it. And Carrie, did you lead a group?
I did, and Clara offered to report out for our group.
Yeah,
Great.
thank you. Yeah, as I was just jotting down some notes to do this, I realized that our conversation surrounded really four things. One, building our power and building relationships both within our own institution, which can be a challenge, and then within the political leadership realm. And the good news that we're celebrating is that we think that in terms of politics, the time is now, because there's money and there is political recognition. There's recognition within other communities like the medical community, and within our own institutions. Everyone knows someone who has this need. And then with respect to how long we've all been going at this, it's been a long time. So the patience that it takes, the really understanding the importance of building those relationships, because then they just pop when you need them, as well as the persistence, really just continuing to go after it. And along with that, understanding your own bandwidth. Sometimes, it would be nice if within our own institutions, it was really easier to develop that leadership, because you're going after the issue, and then you're also looking internally at how you build your base, and it is quite challenging. And then how we've pivoted in every single case and every story we've heard, and specifically with DuPage United, our area hospitals weren't that interested. So regionally, I think we've all pivoted to that standalone model. How do we make that work? And now, we've got this pilot project with a reimbursement rate we don't like, that doesn't make sense, but at least we've gotten some attention in that regard. And it's a baby step, but it's progress. So that's pretty much everything that we talked about. Did I miss anything, group?
Excellent.
I appreciate that. We're almost to the end here. Yvonne, would you like to do a call to action and next steps?
Yes, I would.
Appreciate it. Thank you.
I think that these sessions sort of brought up some really important issues. The idea of building relationships, that the time is now, that we are a group that organizes organized people with organized money, and the persistence that's been shown by what you heard tonight is just so very, very important. So this session has been recorded, and what we'd like you to do is to share this session with your congregation. And the next time you meet or you have a session within your congregation, bring some new people to the table to talk about what's important. The other thing to bring to your attention is there will be 2 virtual trainings in November, one on the 10th and one on the 15th. The 10th session is really for new people that have not been involved in organizing at all, and to learn about the Industrial Areas Foundation, which consists in Metro Illinois of United Power, DuPage United, Lake County United, and the Fox River Valley Initiative. There is also going to be a 3-day training in February. I don't know the times or the places yet, but all of these trainings help us galvanize our community. While the mental health issue is one that we've talked about here tonight, and someone in our group said too, why has it taken so long? We know that there are mental ill people out there. It seems like a no-brainer that this is something that we should work on. So we want to get our congregations involved. And I think all of you, because you're here and you came for a reason, would you like to take this back to your congregations? Are you ready to kind of roll up your sleeves and get involved at a different level? So that's our call to action. There's the survey that's been put on your screen to ask about the 3 issues that are call to action. Would you have a meeting amongst your congregation? Would you like to go to one of the sessions in November? Are you interested in one of the 3-day meetings? And there will also be a national training that'll take place in July. We don't know yet where that will be, but the Industrial Areas Foundation always has some sort of a national training once a year where you go away and get really deeply involved in the organizing process, evaluating evaluating an idea and deciding on how to address it. So please take the poll that's in front of you.
Well, I want to thank everybody for attending tonight, and we look forward to working with you in the future on this issue. Again, I'd recommend the trainings coming up in November, and then the February training, the February 3-day training. It's well worth your time. I've done all of the trainings over the years. So thank you all, and that's it for tonight. You get a few minutes back. Have a good